Right now, most people seem to be connected by audio. If you can hear me, obviously you're connected, but several aren't. So we may have a few people jumping on in the next few minutes. Yes, that's the mic. If you have any problems hearing us during the webinar, please let us know by chat. And those of you who have just joined, please mute your microphone. Thank you. So I'd like to introduce our colleagues today. Again, my name is Samir Mahmoud. I am the CERF training focal point and on the underfunded emergencies team. I'm going to give UNFPA colleagues and CERF colleagues a chance to introduce themselves, and I'll start with Marilyn Pai.
Good morning, everyone. This is Marilyn from the Humanitarian and Fragile Context branch.
This is Nicole Kim from the Program Division at UNFPA.
Hello, this is Anne-Marie Schiller from UNFPA's Research Mobilization branch.
Good morning. My name is Najana Savdic. I'm the chief of the program section for CERF.
Good morning. My name is Madoka Koide. I am also the program officer of the CERF Secretariat.
Great. Thank you, everyone. So why don't we give participants, I know we have several, if you could let us know quickly in the chat, well, we have 128, where you're joining from, just a quick list on the chat where you're joining from so we have an idea, and then we're going to move on. Turkey, Egypt, Lebanon, Pakistan, Copenhagen, Kazakhstan, Bosnia, Denmark, Somalia, Colombia. Fantastic. Great. Well, welcome everyone to the webinar. So I'd like to start with a little thought exercise, and like to imagine for surge staff to imagine what it's going to be like when they need some of the information that we're going to share today. So imagine you're asked to prepare a $1 million UNFPA project for CERF. You're surged out to an emergency, and in maybe 24 hours, you're asked to prepare a CERF proposal. A lot of people approach us and ask, how do I prepare a good CERF? What are the do's and don'ts? What are the tips and tricks? And we get this question quite a bit. And what we'd like to cover today are some of the strategic and technical things that you need to know before you ever put anything in writing. So we're going to cover quite a bit of strategy, and I'll go over some of the outline that we're going to look at today. So we'll do a quick overview of CERF. We'll give a little bit of context, and then we'll talk about UNFPA and CERF. Then we'll talk about what we mean by strategic. The theme of our training is the strategic use of CERF. How is CERF different? What are we looking for in a CERF request? Then the life-saving criteria, the key criteria that CERF allocations are determined by. Your role in the process. Really want to get a little deeper into what it's going to be like as a surge staff in that moment that I described where you're asked to prepare a CERF. And then a few words from UNFPA on timeliness. And then we'll wrap up, and we'll certainly leave time for questions and answers, but as I mentioned earlier, feel free, we'll take a few pauses, but feel free to ask through the chat your questions during the presentation. So next we're going to do a quick overview of CERF and then get a little specific on how much CERF funding UNFPA has received from the CERF. So CERF is a global fund. It's a $450 million per year fund. Since 2006, CERF has given $4.6 billion to nearly 100 countries. So over the last decade, CERF has had a wide reach and significant funding. And we'll talk a little bit about the annual amount that CERF allocates in just a few minutes. Okay. And for those of you, again, who can't hear me, I'm going to speak up. I'm going to try and check the sound. If you can't hear me, please let me know by the chat. Okay. So some of you may not be connected by audio, but for those of you who are, we're going to continue with the sound. So some CERF basics before we go a little deeper. CERF is really broken down into two main components, CERF Rapid Response Window, really what CERF's known for. Think natural disasters, responses to hurricanes, earthquakes, displacement due to conflict. That's what we call the rapid response window. And that's for new emergencies. And what's really important here is the short time frame, 6 months to implement. And yes, it's initiated by the RCHC, and it's the bulk of CERF grants per year. Something CERF is a little less known for, but becoming much more known for, is the underfunded emergencies window. And we say this is for neglected or forgotten emergencies. Think Libya or Mali, things that were in the news last year, but are no longer in the news, and whose funding has gone down due to lack of attention, increased high needs. This is where CERF does a very specific funding and vulnerability analysis. But the important points here to remember, if there's an underfunded allocation, there's a slightly longer time frame, still short, and then it's just less funding per year. It's 2 rounds per year. So that slide really covers the basics. And now we'd like to get a little bit into CERF and UNFPA. So I'm going to hand over to my colleague, Madoka. Madoka, over to you.
Thanks, Samir. Now I would like to share with you some key trends in CERF's contributions to UNFPA. Since 2006, CERF allocated $132 million to UNFPA's emergency operations worldwide. And this represents 3% of the 4.6 billion total CERF allocations to date that Samir mentioned. So it's relatively small, but you can see on this graph that CERF grants to UNFPA has steadily increased in the past 11 years, especially from the rapid response window. You may also notice a big jump from 2015 to 2016. Between these 2 years, UNFPA's annual humanitarian funding increased by over 30%, and CERF allocations to UNFPA increased by over 40%, indicating that CERF is a key sponsor of UNFPA's expanding humanitarian operations. The next graph shows the number of CERF projects implemented by UNFPA in the past 11 years. You may notice that when counting individual projects, UNFPA's share of CERF is even more significant. Last year, UNFPA implemented 53 CERF projects, and this was 12% of all CERF projects in 2016. This means that UNFPA keeps us quite busy with many projects that we have to review, and you might well be working on one of them this year. Now, what does UNFPA do with CERF? UNFPA's CERF projects are focused on 2 sectors. One is sexual and reproductive health, and the other is protection. Nearly 70% of CERF grants to UNFPA has been used to implement emergency sexual and reproductive health projects. We want to commend UNFPA here for its efforts in supplying solid baselines and measurable targets for these health projects with sex and age disaggregated population data and also standardized reproductive health kits used in different emergency operations have been very helpful. Meanwhile, about a quarter of CERF grants to UNFPA has gone to protection projects, especially those focusing on gender-based violence. We understand here collecting data on GBV can be challenging, and writing grant proposals with tangible outputs can also be tricky for this sector. But with the majority of CERF used to respond to conflict these days, we have been funding more protection projects, and we want to support agencies, including UNFPA, in preparing stronger proposals. And we will talk more about this a bit later. But I will stop here and hand back to Samir. He will talk briefly about the implications of last year's World Humanitarian Summit for CERF. Over to you, Samir.
Great, thanks, Madoka. So some interesting data on UNFPA, some interesting trends, and we wanted to close the overview section by talking a little bit about the future of CERF. And the future of CERF was definitely discussed at the World Humanitarian Summit. So let's take a look a little bit at what came out of the World Humanitarian Summit. And what's clear, what's bold, what's in yellow is a 1 billion CERF. There's a few other things clearly that came out: innovative financing, localization, and the grand bargain. But I think what's important here for participants is, with the move to 1 billion, well, it's in everyone's interest to get really good at applying for CERF grants. So in the future, there'll be more resources, and we're really focusing on how to quickly, efficiently, with good timeliness, apply for those CERF grants. With that, we're going to get a little bit into the strategic use of CERF and what we mean by the term strategic. But before that, I'm going to take a pause, give a chance for participants to ask a question. We're monitoring the chat, so if you could ask or comment via the chat, we're closely monitoring. One comment has come from Hira. It's quite evident that CERF funding has been increased for UNFPA in the last decade. With the donor crunch, do we foresee funding increase for UNFPA, funding implications, particularly for Pakistan? I'm looking at Marilyn and seeing if we can quickly, that's a very good question. Why don't we park that for the questions and answers? We see funding implications. We're going to move that for the questions and answers, but we'll keep that in mind. Any other questions via the chat? 1 billion, for which time frame? Yovanka, very good. So the target time frame for 1 billion is 2018. It's a flexible time frame. I think it's been important to be aspirational, and there's a lot of great information online and documents about the Grand Bargain, the World Humanitarian Summit, and CERF. But right now the target, I believe, is 2018. But we're in the same funding environment as many people, and in some cases it's a challenge. So without setting a particular date, we say in the near future, the aim is to have 1 billion. Okay, just continuing to monitor the chat. What do we mean by localization of humanitarian aid? Okay, let's put that for the Q&A. And what do we mean? Okay. And innovative partnerships. In the interest of time, I would like to get to some of these questions. In the interest of time, we're going to park some of the World Humanitarian Summit questions for the Q&A, and then I'm just going to wrap up this section with one more question on the 1 billion. Is it 1 billion CERF increased or decreased than previous years? It's a good question. Right now, 450 million per year is allocated from CERF, and that's been the same number for 10 years, although needs have clearly increased. Total allocations per year, the aim is 1 billion. So that's more than doubling of the CERF Secretariat, of the CERF funding right now. Okay, so we're going to, in the interest of time, we're going to move on, and I'm going to answer that last question. The biggest contributor to CERF is right now is the UK, and that's important to keep in mind. And then we're going to jot down some of these questions. A lot of great questions, but we're going to save some for the Q&A. So strategic use of CERF. What do we mean by strategic? Strategic means many things to many different people. So we want to talk a little bit about what it means to you, what it means to us, and how it's useful when you're surged out to that emergency to fill out that CERF application in 24 hours. We're going to ask the group, all participants, a big picture question. So get ready to respond by chat. So in the CERF submission, if you can imagine yourself, again, in the emergency, it's a lot of competition for funding, there's high needs, short amount of time. Which is more important? A, that the humanitarian needs have been strategically prioritized, or B, all agencies involved get some funding in the CERF request. So we're monitoring the chat. A lot of A's. Both. I like both. Okay, that's good. Interesting response from Fahmia. Says both. Most people say A and B. And Judith says both. And we have a B. So Jovanka says B. Jovanka, I'm going to attempt to unmute your mic and see if you can elaborate a little bit on why you say B. Jovanka, are you there? Oh, okay. Jovanka, go ahead. We can hear you now.
Yeah, okay. So my consideration is that if you go with A, humanitarian needs have been strategically prioritized, it can be a correct response. I'm not saying no, but it's very important that all agencies are engaged in this prioritization stage. Otherwise, agencies which are not dealing with certain issues may, let's say SRH is not in the mandate of one of the agencies that participate in this prioritization meeting, whatever, and some needs of the population may not be addressed and even recognized as priorities. This is why I think that everybody should be involved in the prioritization stage or get some funds, because if we have like we had a flow of migrants traveling through the Balkans with the migrant crisis in 2015 and 16, it's obvious that the population has different needs, and each agency is specialized or has a special niche in which it can support the needs of the population on the move. This is why I said B. So children are important, SRH is important, nutrition is important. So there are different aspects, and we need to make sure that all needs are addressed.
Thank you very much, Ivanka. I'm going to just mute your mic and comment on what you said. What I heard you say is that there's a lot of challenges, a lot of things are important in SRH, and not always prioritized initially in HRPs and response plans. You can make some excellent points that we're going to touch on in the next few slides. So what we often hear is that while A is what the goal is, there's often what we call pressure for B. There's a lot of underfunding, there's competition for funds, there's high needs, and all agencies are trying to get involved in the CERF process. And that brings us to our next point. Here we have a nice, delicious looking cake, and you can imagine what it's representing. And there's a lot of pressure to treat sometimes CERF like a cake. But as we know, that's not the goal. CERF is not a cake-cutting exercise in which everyone gets a piece. The real goal is to use CERF for maximum impact. And therefore, the focus should be on a more strategic approach. And we'll talk a little bit about the tools and the techniques for that. In the field, we had someone give us a really nice summary of what we're trying to convey here. And this is not about sharing the cake, but doing the right thing at the right time based on country needs. So let's take a little bit closer look at what we mean, what we've come to determine some of the definition of strategic use here at the CERF Secretariat. So we're looking for clearly prioritized and coherent allocations. Focus on the most urgent life-saving needs. And we're going to, like I said, get to the life-saving criteria. And then, to put it in the context of a full CERF request from all the agencies responding to an emergency, well coordinated both among aid agencies and with other funding sources. CERF is meant, especially in the rapid response, to jumpstart operations. Now, many of you might wonder, why is there a picture of a boat in the background? What does that have to do with strategic use? We sat around the table the other day and we said, well, what happens in cases where projects that don't meet this criteria, that aren't prioritized, that are unfocused and poorly coordinated? Well, in real life, in many cases, some agencies simply miss the boat. And that's what we're trying to convey here. If you bring a strong CERF project to the table and are able to prioritize, be focused and coordinated, it'll help avoid missing that boat. So before we move on, any questions on strategic use? We had a really great comment. We had some provocative questions and a few different perspectives. But I'll give another minute for a few questions about the strategic use portion that we just covered. Okay. I have a comment from Hira. The question is, or the comment is, why do we use the word strategic? Being strategic is to focus long-term interventions, whereas the indicators you mentioned is more of a criteria. Good question. And like I said, strategic means many things to different people. Really, we're being asked by our donors, we are aiming, and it's always been the goal for the last 10 years, to use CERF for maximum impact. It's not just more money. It's not just another source to kind of fill gaps or last resort when there's breaks in funding. Really, there's a what we call specific CERF niche. And the next module, the next topic, this life-saving criteria, will really help narrow down the types of activities. Being strategic means working with partners to address particular aspects of the emergency, to address particular geographic locations, target populations, themes, and we'll unpack that a bit later on when we go over the strong CERF projects, the elements of strong CERF projects. But excellent question. Okay, and monitoring the chat now. And can we use CERF to fund positions? Okay, very specific question. I'll end this little break that we have now with this specific question. Yes, CERF can fund positions. Limited amount. We have some rules of thumb on how much, but it actually brings up a more important point that absolutely CERF is meant to fund the response that fits, that results in impact in that 6 months, in that 9 months that we talked about. Is it meant to fund staffing gaps? Absolutely not. Are there staffing needs in responses? Absolutely. So we really, and if you look at it, when you look at a CERF project budget, you'll see there's room for subgranting to partners, there's room for operating expenses, but really supplies, really funding towards what's needed for the emergency as opposed to the overhead cost is what we're aiming for. And we'll talk about that a little bit more again in the the elements of a strong CERF project. So let's move on to the life-saving criteria. We're doing very well on time. And it's important to note, all CERF allocations are decided in the context of the CERF life-saving criteria. So for those of you who haven't seen the CERF life-saving criteria, this is the first page of, I think, the most critical document in CERF. So this was developed many years ago in 2008 with the other agencies. And on the very first page, it really describes the objectives: promote early action, response to reduced loss of life, describes time-critical requirements, strengthening core elements in underfunded crises. So really, those 3 points really summarize the objective of CERF. What's relevant for you are the many pages that are sector and cluster specific. GBV, health, Marilyn and the CERF, we took a look at this document recently and really reviewed what's in there. And I think there's some great language. It's a great tool, and we really promote it as a tool for you in the field. So what I would do if I was writing a CERF tomorrow, next to the CERF proposal, I would have the CERF life-saving criteria. It's the #1 document I recommend everyone read, even if it's the first page only. That's the top document. So let's talk a little bit about how the life-saving criteria fits into the bigger picture. So simply having a collection of life-saving activities does not mean a strong CERF. We really look at it as a tool for prioritizing. Going back to the comments, a lot of needs, limited amount of money. How do you determine who gets what? How do you avoid that cake cutting? You prioritize. So, of course, the activities, the response should be based on a needs assessment. Priority should be a priority in a response plan. And one key element, which sometimes creates challenges, is the activities need to be completed within the implementation period. And I'll repeat it: 6 months for rapid response, 9 months for underfunded. A really relatively limited amount of time. With this, I'm going to hand over to Madoka, who's going to go through a little bit of an exercise to take a deeper look at what we mean, what some real-life examples of life-saving activities and CERF's response to them. Over to you, Madoka.
Thanks, Samir. Now I'm going to show you 3 examples taken from actual UNFPA submissions, and we'll ask you to decide if they meet the life-saving criteria. So the first example is from Bangladesh, as you can see, where UNFPA submitted a CERF project proposal for protection focusing on GBV. This was after a new influx of Myanmar nationals, many of them identified as Rohingyas, fled clashes in northern Rakhine Strait in Myanmar and crossed the border into Bangladesh last December. So proposed activities for this project included establishment of women-friendly spaces, psychological support, GBV referrals, as well as distribution of dignity kits. Now, how do you think? I know I'm only giving you limited context here, but can we determine, based on what we know, if this proposal meets the life-saving criteria? You can go ahead and please type yes or no in the chat section at the bottom right part of your screen. So I see many yeses, mostly yeses. Yep.
Big yes, Madoka.
Yeah, big yes. Okay, very good. So,
big yes.
In this case, was there one no?
Yeah, there was one no. Yeah.
Oh, can we see who said no?
Okay, Eugene seems to say no.
Okay.
Which is good. We like different
them.
answers, unique answers. Eugene, I'm going to unmute your mic. Could you elaborate a little bit on why you said no? Eugene, I can hear you. Could you speak up?
Can you hear me?
Loud and clear. Go ahead, Eugene.
Yes, can you hear me?
Loud and clear. We hear you.
Oh, okay. Yeah, I don't think any of the 3 activities is life-saving. These are activities that could support life-saving activities that I don't see in what form by establishing or undertaking those activities we are going to save lives.
Okay, thank you for that, Eugene. We're going to just mute the mic, just reduce the background noise, and I'm going to hand over back to Madoka.
Thank you. So in this case, the answer actually was yes. And why yes? Because the multi-sector initial rapid assessment MIRA noted a sharp increase in protection-related concerns. So this included sexual, gender-based, physical, psychological violence. Also, some child protection concerns were noted in MIRA, where these Myanmar nationals were newly arriving. So the proposed activities of this project focused to quickly address these concerns. They were time-critical interventions to ensure immediate access of these affected women and girls to protection services, also provision of essential hygiene items in an emergency context. So in short, the needs were clearly established in this proposal, and it was prioritized in an inter-sector process, and the response activities were designed to meet them directly, meet these needs strategically and also quickly within the time frame. Another commendable aspect of this proposal, even though we didn't mention it in the slide, was that it was complementary to another project of UNFPA, which was part of a joint health project in the same application. So here, coordination between UNFPA, IOM, which was co-leading the health project, and other partners allowed for strengthening of GBV referral pathways. Even this response was marked low-profile response in a politically sensitive situation. And this complementary approach ensures that GBV survivors are identified and referred through the protection project could receive necessary medical treatment, including clinical management of rape through the health project. Okay. So let's go to the next example. Here we have another proposal submitted from Angola, where UNFPA proposed a health project in response to drought. Proposed activities included distribution of dignity kits and IEC materials on sexual and reproductive health. Now, what do you think of this one? Does this proposal meet the life-saving criteria? Could everyone go ahead and type again yes or no in the chat section? So now I see a no.
A few no's, a yes, yes for dignity kits, and then a no for
A more mixed bag of
NO for IEC. Interesting results, Madoka. And then yes.
some yes. Okay, so there are some hesitations. There are no, but some elements could be yes, yes, no. Okay. Oh, depends. Yeah, very good. So maybe we don't have enough information here.
Edith says yes and no. Okay.
Okay. So in the interest of time, we're going to go ahead and give an answer. In this case, the answer was no. Why no? Because we couldn't see a direct link between this project and the trigger of the crisis, which was the drought. Or maybe there was a link, but it wasn't explained well enough, unfortunately, for us to understand. So feedback provided from the CERF Secretariat for this proposal was that the drought may be an aggravating factor, but the activities proposed in this project could have taken place as part of regular reproductive health programming. And it wasn't suited, it wasn't the best fit for CERF, especially for the rapid response window. So key message here is that for rapid response window of CERF, the direct relationship between the trigger and the resulting humanitarian needs must be very clearly explained, and the CERF project activities must focus only on these new needs. All right, so let's go to the last example. This was from this year's underfunded allocation to Libya, which we just completed the review. A background to note for this example is that Libya's 2017 humanitarian response plan has prioritized the health sector response already to strengthen the country's healthcare system, which was on the verge of collapse. Here, proposed activities included the training of healthcare practitioners, deployment of mobile health teams with reproductive health kits, and provision of medical supplies, equipment, and technical support to primary care facilities. Now, does this proposal meet the life-saving criteria? Once again, can everyone type in yes or no in the chat section? I see a lot of yes.
A lot of yes, Madoka.
Yeah, mobile support. This one has a lot of yes, yeah. Maybe I gave too much clue.
Mostly yes.
Yes. So this, in this case, as you all imagine, this was yes. And this met a lot of CERF's life-saving criteria that Samir earlier mentioned, especially on the section describing what could be plausible health interventions. So it included emergency primary health care and provision of quick turnover medical supplies, equipment, and it addressed noted needs of women for basic obstetric services to be restored and maintained, especially in the conflict-affected areas that were hard to reach in the country. Some of you may have noticed that this proposal included training, which is not a direct assistance. Training is often found in the gray zone of the life-saving criteria. But the bottom line here is that the CERF can only fund capacity building in support of specific project activities which can address emergency needs of the beneficiaries within the implementation time period. So for underfunded, it's 9 months, if you remember, and for a rapid response, it's only 6 months. This means that recurrent costs for training fall outside of life-saving criteria. In this case, though, the lack of healthcare providers was a well-evidenced gap, and there was a need to train them in order to provide primary reproductive healthcare services to people in need. And these trained nurses and midwives were, in fact, directly part of the mobile teams to provide assistance. So I hope discussing these examples in depth was helpful to you, and I'm going to hand back to Samir, and he will talk a little bit more about the CERF's niche in response.
Great, thank you very much, Madoka. I see some comments on the chat from Nadia and others, the CERF support training. I think Madoka summarized a bit on CERF's position on training, and we can elaborate during the Q&A, but that was a really important point on what needs to be seen for training and proposals. So what's, I think, clear that came out of the 3 examples is that there's a gray zone. There are clearly activities that fall under what we describe as the gray zone. Again, if you look at that life-saving criteria, there's a column that says in what context. It's context-specific. An activity that might fit one context might not fit CERF in a different context. And in some cases, again, this is maybe very abstract, maybe a little bit challenging to understand. So we're going to take a look at what we call the iceberg to kind of illustrate what we mean by gray zone activities. So this is an exercise we do in the field to represent an emergency. The iceberg is a humanitarian emergency. Above the waterline are activities that address immediate needs, the smaller part of the iceberg. Below the waterline are longer-term needs or approaches. And then along the waterline is what we call the gray zone. So just some examples of what we're looking for. We're looking for the tip of the iceberg activities. Those activities, again, that are prioritized, meet the life-saving criteria, are coordinated, are focused. And what would be some examples? Well, something that's more longer term is a project that's focused on capacity building. Now, is that saying that no project can come with any capacity building elements? Well, training, in a sense, has capacity building elements. Is it the primary goal to build capacity? No. It's to respond to the emergency. So capacity building in itself is more long-term, is an example. And then something that falls in the gray area, the gray zone, could be countrywide immunization. That might fit in some contexts and not in others. These are just examples. And then an example of what would fall in the life-saving criteria, in the niche, that tip of the iceberg, could be potable water. So I'm going to pause and give a chance for any comments through the chat. Do countries with refugees, Nihal has a question, do countries with refugees and not in a crisis, can they apply for CERF? It's a good question. It's really difficult to do a case by case, but refugees, there's been all different kinds of CERF requests with refugees. It's very tough to say one or another. And again, so the questions kind of become, is there a trigger? Has it been selected for underfunded? And that's where it's important to go deeper into whether or not it meets the rapid response window or the underfunded emergencies window. Other questions? Okay, just an important comment from here. Usually prioritizing life-saving activities goes under the table due to power struggle amongst various agencies, resultantly clusters like education, community restoration, which might not be life-saving compared with health, water, shelter. How do you think we can overcome this at the country office level? Very good. Good, excellent question. I really want to make that part of the elements of a strong CERF request discussion. So we're jotting that down. We're going to come and circle back to that. Okay. And we've discussed what kind of capacity building. It's a little tough to get specific, but I think the point being approaching CERF with a purely capacity building focused project becomes a challenge. Doesn't necessarily fit in the life-saving criteria. Another opportunity to go a little bit deeper into the life-saving criteria. Would life-saving health services such as emergency obstetrics, etc., not also fit into the immediate humanitarian needs category? This is part of the conversation we had with Marilyn. And Marilyn, if you have any comments, it was really how to articulate the life-saving element of it. I'm going to hand over for a moment to Marilyn.
Yeah, if you go to the life-saving criteria, it's very clear in terms of which intervention can be funded by the CERF Secretariat for GBV, gender-based violence, and SRH. So I will encourage everyone to look at this this life-saving criteria and you just make your own judgment. Is what you're proposing, really aligning with what has been agreed at the HQ level on what we consider life-saving. But most of, actually on SRH, we don't encounter that many issues. It's more on gender-based violence. But I think we're making progress to make it clear that there is a very close link to life-saving.
Thank you very much, Marilyn. So in the interest of time, we're going to move on and try and get to a few of these questions, which I still see on the chat during the Q&A. But we wanted to cover one more specific CERF module we call roles and responsibilities. So your role as a surge staff in the emergency. So very quickly, the question is, this is an important question, and it's important to start here. So when you're in the emergency, many different agencies would like to make a CERF request. But there's really one person who's responsible, accountable for the CERF and its strategic use. So very quick question to participants. Any idea who is responsible for the strategic use? Ali says the HC, RCO, humanitarian coordinator. Correct. So it's important to recognize that there are some very clear decision makers and a clear decision-making mechanism. And I think the objective for us and everyone in the field is to think about how to influence those decision makers without being the ones making the decisions. There is room, and what we do in our training in the field is give tools, talk about challenges, and influencing those decision makers. So we've tried to summarize the CERF process, the CERF application process, in a flowchart. And the point is not to be able to read every part of the flowchart, but really look at two things. Along the top, there are the different phases of the emergency, starting with the crisis, going all the way to prioritization and the application preparation. And on the left-hand side are the many stakeholders, everyone from OCHA to the RCHC, who we mentioned is quite important, and agencies and clusters. Now, many of you may play different roles when you're surged out. But one key role for those working on the CERF request is this section of our flowchart, to provide analysis of funding. It goes well beyond this. This won't capture everything. To coordinate with other agencies. And then once the decisions are made by this group, the HCT, RCHC, is to prepare that project application, revise projects based on CERF feedback. So we have a critical role, and the objective is how do we influence decision makers? How do we articulate the importance of SRH, of GBV? How do we get, really, in summary, a seat at the table? Now let's talk a little bit about the signs of a strong CERF request to help influence that process, to make sure that we get a seat at the table, that surge staff make an impact and show that there's impact. A few definite ways, and we've said this before, but it's worth saying again, a clear strategy focused on life-saving needs, and again, refer to that life-saving criteria. Targeting. One example of a lack of targeting, we received a submission from Sudan several years ago, which had projects all over Darfur. We did a training, and 1 year later, they were able to narrow down a different CERF request down to the locality level in northern Darfur. So a huge contrast, and they decided to have a geographic focus. It could be focused on population, a theme. We even encourage enabling sectors. But for this group, what's important is to really narrow down the target with the other agencies. And then what fits within CERF's niche. Really, rapid response is about jump-starting the response, not a lender of last resort, not a gap filling, but really how can CERF jump-start the operation. And then two more points, using baseline data and measurable outputs. I mean, maybe it's quite obvious, but in some cases, it's missing. To the extent possible, having baseline data and measurable outputs. And then finally, a very technical, tactical point, no project less than $100,000. So I'll take this chance just to pause before I hand over to Marilyn. Any questions on the roles and responsibilities? The CERF Secretariat, from here, the CERF Secretariat consider baseline data or needs assessments in decision making. It's definitely a question on the template, and I think when you perhaps are in Brindisi, you may see a CERF application template which will show, yes, absolutely, that's key to know, and that's helpful, again, for explaining, in the cases of rapid response, the trigger or an underfunded, how it was prioritized, why it was prioritized. I'm just monitoring the chat. What happens when baseline data is not available? Marilyn, any comments on baseline data?
Yeah, I mean, usually some of country office also make reference to national data, and especially that goes for GBV prevalence. We are also having an FPA, the miscalculation, that also give like, an estimate on how many people will be affected and how will be our, you will define our targeted intervention. It's important that we have, to a certain extent, some data to refer to. Otherwise, again, the issue of prioritization will come back. Why is that such an important intervention? And that will be questioned by the CERF Secretariat.
Great, thank you, Marilyn. So monitoring the chat, a lot of questions on baseline data. I hope that was helpful in understanding cases where there isn't a lot of data, baseline data. Those are some of the tools to use. The MISP, for example, is something we discussed preparing for the webinar. With that, and in the interest of time, I'm going to now hand over to Marilyn, who's going to talk a little bit about timeliness. Over to you, Marilyn.
Yeah, thank you. And just before I jump in the presentation, maybe can I just also clarify on this question? Can you articulate OCHA and intercluster role? Here, I will also mention UNFPA role in the intercluster, and where we also can influence the prioritization process is to, as you know, UNFPA now is taking the leadership role on GBVs since early this year. So when there is a CERF request, also, as a lead agency, also highly recommend you to be in touch with all your implementing partners and all the partners to discuss the CERF proposal. And OCHA, overall, is the one coordinating all the cluster. And obviously, when it comes to the submission of the CERF proposal, OCHA will be in touch and will be working very closely with the humanitarian coordinator on that. So it's very important that we have a close relationship with OCHA at the country office level. Okay, so let me turn now what UNFPA also have been doing recently, because as you can see, our funding for CERF has increased tremendously, and especially since last year, 44%. And at the same time, there is a lot of grants. We're working with implementing partners, and this is a really a priority issue for the CERF Secretariat and the CERF Advisory Board, which is composed of many donors, to see to what extent each agency can timely implement activities and forward the grant to the implementing partners. So if you look at where we stand, right now, UNFPA, as you can see in this slide, is really the second lowest. And you can see that most of our grants for rapid response is being implemented within 3 months and 4 months, and which is quite worrisome. And this is, again, go back to, do we want to see and do we want to show that UNFPA is a credible humanitarian actor on the ground? We really have to make sure that those grants are being forwarded to the IPs as soon as possible, but we also work closely with them. So in view of this poor performance, UNFPA has taken a series of action to improve our performance of timeliness. And one of them is to set up an internal benchmark. And you may have received and see this financial tracking tools that UNFPA has developed with an internal benchmark of 25 days, 25 calendar days. It's very important. It's an internal benchmark, but it's very important that we try to meet this internal benchmark. And we have seen in the past that actually we can do that. So it's not a benchmark that has been set up out of the blue, that actually this is something that UNFPA is able to do. And since we have introduced this financial monitoring tracking tool, we can see a progress made by UNFPA organizations. And this financial tracking tool is being monitored by the UNFPA Humanitarian Steering Committee that is chaired by the UNFPA Executive Director, Baba Tunde, and with all senior management on a monthly basis. So we are really taking the speed of implementation of CERF very seriously. And at the last CERF consultation, we have been told by the CERF Advisory Board that UNFPA has to do more, just on the, not only on the timeliness, but also on the issue of not asking for cost extension, and really making sure that we implement the funding within the time frame. So as a reminder, it's 6 months for rapid response and 9 months for the underfunding window. And we can see that usually we are very poor performer for the underfunding window. I don't know, there is this feeling that you have more time to deliver, but actually it's, the time is the same, and even our internal benchmark. We also had issued UNFPA a CERF guidance note that you all have received, and here it's more giving like some tips and on how to speed up the implementation. One of the aspects that we encourage everyone is on the preparedness phase, making sure that you implement your minimum preparedness actions. And for the CERF funding, one of the preparedness actions that is very important to consider is your relationship with the implementing partners, right? So it's important to have pre-agreement, pre-implementing partners agreements, working on a sort of pre-work plan. So then as soon as you receive the CERF fund, you go and to implement the CERF funding. You don't wait for the CERF funding to start to have this discussion with your implementing partner. You also think about pre-positioning of some of the reproductive health or dignity kits well in advance, so that will help you to have a more comprehensive CERF programming. Next slide. And then one of the last point is about also that you can access before the CERF funding the UNFPA emergency fund. And here we encourage you to use the emergency fund to utilize for some items that will take time to be delivered. And I'm thinking especially about delivery beds, because we know with PSB that our we don't have such we have issue with vendors, and that may take time. So please use this funding and not the CERF funding for that kind of items. And also, if you think of having someone to monitor and implement the CERF, you can also put that in the emergency fund. So it's also help you to supplement the CERF funding and making sure you have everything in place before you receive the CERF funding. So that's it for me.
Great, thank you very much, Marilyn. So we're doing well on time, and I wanted to share two things before we open up the Q&A. One is the CERF website. I think the #1 resource, and I use it every day as a program officer, Partner Resources tab. There you'll find it is a drop-down training materials, including this presentation, which will be posted, the guidance, the templates, and a lot of other interesting, useful tools. So this is my promotion of the CERF website. And lastly, our contact information. I think one of the best ways, easiest ways, is to really get in touch. The CERF website is there, Marilyn's contact, my contact, and Madoka's. And in fact, the CERF website also contains our contact information if you scroll to the bottom. With that, I'm going to ask everyone online to give us 5 more minutes, because we have such great resource people here that it's an excellent opportunity to ask questions. I'm going to open up the Q&A, and I'm already monitoring the chat. Hari says, can CERF be used for pre-positioning or replacement of RH dignity kits? Pre-positioning, no. Restocking supplies that were used in emergency, I believe so. Madoka is the rapid response team member here, and we have the chief of the section, Snezhna. So that's a very good specific question. UNFPA colleagues were monitoring the chat. Here it says, implementing MPA's BCP's contingency prepared plan is a heavy investment. In order to improve timeliness, investing in MPAs, do you think it's cost effective? I leave that to my FPA colleagues.
Yes, of course. And please, we have to keep in mind that actually, even in terms of dollars, if you invest $1 in preparedness, you will see the saving in your response. So yes, it's cost effective, and although also it takes a bit of time from our side, it's worth it to do it. Because at the end of the day, what we want to demonstrate is that UNFPA is able to respond to a rapid emergency. So we don't have to wait for having this discussion with our implementing partners. We're doing some pre-positioning well in advance, and we are on the ground on day one, not like 10 days later.
Okay, another question, I'm just going to moderate a bit. Is there a means for the fast-track procedure to be automatically activated for any CERF grant? That comes from Makule.
So the fast-track procedure, yes, it can be. You can apply for it, but it's not automatic activation. So you will have to send your FTPs to UNFPA, and there is this whole procedure. It's also part of the CERF guidance note. So please do so as soon as you're thinking of receiving CERF grants. You can also do that like a bit earlier. So don't wait for the CERF grant to come in. You know that you're going to deal with an emergency. So just do that at least like 2-3 days even before you start submitting your CERF grants.
If I can add really quickly, just to say that we're also looking to integrate various elements into regular programming policies that will allow you to kind of streamline certain processes during a crisis, if you look at a lot of the programming one. So we really encourage you to make sure you're looking at all the program policies or all the various policies to see where you can kind of streamline some of the processes without having to activate the FTPs.
Okay, thank you. Continuing to monitor the chat. I saw a question, the minimum is 100,000. Is there a maximum amount? No, there's no maximum, but again, this is where a consolidated multi-agency CERF request comes into play. The amounts need to be prioritized. I think, Madoka, you had some averages on UNFPA projects maybe for the last few years.
The UNFPA projects tend to be on the smaller side. The envelope is average about 250,000 to 300,000 data projects, but it's becoming bigger, and I think it's a reflection of the operational capacity of UNFPA and humanitarian sphere growing. For reference, the average size of CERF projects overall for different sectors is about 900,000, so close to $1 million. But it's very sectoral, needs are different. Like shelter always is big because the supply costs are so big. But what we usually look at is that if the sectoral response is prioritized in overall response scale, and if it is a substantive impact that can carry out through the project.
Okay, thank you, Madoka. And Marilyn has a comment.
Yeah, and just in terms of defining the overall envelope, please also work with your cluster, right? If you are going to submit an SRH funding proposal, look at the overall envelope for the health clusters. The same thing for GBV and the protections. I mean, usually GBV also should, there should be a good ratio. So think about that. Make sure there is some sort of alignment.
Okay, and I get a great question on complementarity. Is there a way to emphasize complementarity on your application, say with a UNHCR proposal? CERF does accept joint projects, so if that's what you mean by complementarity. That's a very important word at CERF, complementarity with other projects, activities, and other sources of funding. So that makes an even, I'd say, stronger CERF request. Continuing to monitor the chat. Everyone online, thank you for staying online. We're going to stay online just a few minutes, and we have another comment.
I would just like to alert all the participants to the resource mobilization toolkit that is accessible easily for all UNFPA staff, where we have a very well-resourced page on humanitarian funding. So this can orient you much more widely on sources of humanitarian funding in crisis situations, but there is also a lot of background information on CERF. For example, the guidance note that Marilyn mentioned is there. We will also upload this presentation. Then there is much more there, so please have a look.
Great, thank you. And another comment, again, we have some very helpful resource people continuing online, so stay with us.
I just want to add quickly to Anne-Marie is that the link to the Resource Mobilization Toolkit is on the PPM on the front page and the useful links, and we've also just added the CERF website too, so you can go to the PPM to be able to get all the information you need.
Okay, great. So with that, we're going to take, there are so many questions on the chat. We won't be able to get to all of them. I think some fantastic questions. We are trying to see if there's a few common questions, everything from the very technical to the more strategic. Are individual applications by agencies accepted? No, they're often multi-agency requests, and again, the RCHC is the person responsible. But let's go back a minute to think about what it's like, what it will be like to be in your shoes in the case of an emergency. Just wanted to ask the last ask for participants, what are one key takeaway from here that anyone would be able to use in Brindisi in that next surge, that next moment where a message comes across their email, their desk that says, time to prepare a CERF, the HC, the RC has decided for a CERF request. So this is my ask to the group, and with that, we will wrap up. Monitoring the chat, strategic use. Thank you, Dr. Mukesh. Any other takeaways from today? Sustainability. Prepare the baseline data, life-saving activities, the life-saving criteria. I'm seeing a lot of reference to life-saving preparedness. And we're continuing to monitor the chat. Articulate better with other UN agencies. I think that's a great takeaway. And integrate MPA into routine programming. CERF life-saving activities and addressing the current needs. Prioritize needs and signing MOUs with partners. Last bit of monitoring on the chat, complementarity and strong proposals. Jump-starting the funds and the life-saving criteria. Thank you, everyone. That closes the webinar. We want to thank you for your participation. I'm going to keep the contact information on the screen. Please, please, please send us your questions via email and really take a look and utilize that CERF website. Last comments from UNFPA or CERF here. I'm going to hand over to Marilyn for some final words.
Yeah, thank you, everyone. It's a great, we had like more than 200 people online today. This is a very good participation from UNFPA. And for those that will come to Brindisi, we look forward to see you there. And I think the session, it's very important that you keep the session in mind because we will also go back to it. Just a few words on there was some question on the ground bargains and the localizations. As you know, UNFPA is also committing to the ground bargain, and we can send few documents on that if requesting. And one of the, the ground bargain is about localization. And it's about making sure that our funding are going to national partners. And we have a target of 25%. So again, the CERF and our relationship with implementing partner is very important and is a priority for UNFPA.
Thank you very much, Marilyn. With that, we're going to close the webinar. The final bit of information, the PowerPoint will be shared and will be posted on the CERF website, another great resource tool. Thank you, everyone, and have a very nice rest of your day. Bye-bye.